fractures to the wrist, such as a radius fracture. So if you have a fracture and you break this bone, or sometimes this right here is your ulna. See this bone right here? That's your ulna. Sometimes when you fall and you put your arm out, not only will you break this bone, but sometimes you can break this bone too. So anything like that can cause problems with being able to turn your palm up and turn your palm down. My name is Huang. I'm an occupational therapist and certified hand therapist, and I shared some videos on distal radius fractures. I've been getting a lot of them in my clinic lately. I don't know, it's a season. But one of the biggest challenges that people have is that they cannot turn their palm up and down. So I'm going to share with you a couple of things that I'm doing with my patients that if you're struggling with, you can do it as well. Now, with the ability to turn your palm up and down, it takes a little bit more work and it does take time. So let me explain it. If you have the patience to listen to it, it can help you understand why it hurts and why it takes time and what you need to do to essentially fix the problem. The bone that you broke, right? That bone is down here, but it's a long bone. So it goes from your elbow and it comes all the way down to your wrist. Now this bone right here, when you turn your palm up and you turn your palm down, that's the bone that rolls. So let me get another marker. Here we go. This is the one that's broken, right? So when you turn your palm up, then the two bones are kind of parallel. When you turn your palm down, one has to roll on top of the other. So a lot of times people tell me, oh my God, Huang, I have so much pain on this side. This is ulnar-sided wrist pain. Our muscles start in our elbow and go to our wrist. They're the ones that help us to move our wrists up and down. The muscles that move your fingers cross your wrists, right? They start in your elbow, cross your wrist, and come to your fingers and let you make a fist and open. So when you break your wrist and you have surgery, even if you break it and you don't have surgery, you're usually immobilized. You're kind of put in a cast, a splint, and you're told not to move it for a while, right? If you have surgery, then you're also like, they had to go in there, it's like carpenter work, plate and screws and the works, and you have swelling and scarring. And it's gonna stop you from being able to turn your palm up and down. It causes a lot of pain over here. That majority of the time is normal. And what happens is you wanna see that as you get more motion, it becomes less and less painful. My name is Huang. I am a therapy clinic owner here at Hands-On Therapy Services in Miami. And this is one of the hardest things that people try to do on their own. They can't do it on their own. So outside of just watching this video for educational purposes and for some tips, really go work with your therapist because it can be really helpful to have someone kind of work on that arm a little bit to get you advancing a little bit faster and further. The ability to turn your palm up and down, there's a joint right here between these bones, but it's not just down here, it's up here too. So think of a hinge door. The door, opens because it's on hinges, right? If one of those hinges are broken, your door doesn't open, your door doesn't close. And so it's the same kind of idea over here. The reason why I bring it up is because you want to start with your exercises. If you're trying to get supination and pronation. Supination, you need palms up, is because you want to be able to get to your face, right? You want to be able to wash your face. Pronation is palms down. You want to be able to get into your pocket. You want to be able to type. You ride a bike. I have a patient who's having a hard time riding his bike because he can't turn his palm down, right? So the most simplest exercise that you can do at the beginning, and what you do at the beginning and what you do later on as you progress, they're two different things, right? My handy dandy towel is the best exercise tool. You probably already have it. You don't have to buy anything special. Fold it in half, roll that sucker up. A hand towel works best because you have this about this size, right? If you want to get to turn your palm up and turn your palm down, stuff a towel right here. Use this arm, bone, your humerus, pin your shoulder down, and then work on turning your palm up and turning your palm down. If you don't pin your shoulder down, what happens is when you try to turn your palm up, you dig your elbow into your side, you're compensating. You're going like this or you're going like this. So then what happens is you look like you're getting all of this motion and you're not doing anything, right? And the other problem that I see all the time with people who cannot turn their palm up and down. They eventually develop shoulder problems. I'm trying to help you out. I see it all the time. These are what therapists, that's what I call patterns of how your body likes to compensate. So get some supination and some pronation first, right? You can do this as many times as you want. Use a towel. That's in your first month. Second thing that you want to do to get more motion, you can't do this until about 6 weeks after surgery or after a break, because your bones have to set first, and you have to have what's called clinical healing before you can do anything that's called strengthening, right? So doing anything with a hammer is considered strengthening because it's heavy, right? It's not just heavy, it's heavy on the top. So when you hold it and you turn your palm up and you turn your palm down, you're actually using muscles, right? So at the beginning, you can use it to help stretch you into that position. You want to get it to be parallel to the ground, right? You want to be parallel to the ground. The reason why you want to be parallel, right, is that when you go like this, you start twisting at your wrist. I don't need your wrist to move. I need your forearm to move right there, right? Right there. That's what you need to move, right? So when you start thinking you're doing more, you're probably just overstretching other things versus the thing that you're trying to stretch. So you're overstretching your wrist and you really need it to stretch your forearm. So the key thing, handy dandy towel, and then you can turn your palm up. Now if you want to stretch it, the weight of the hammer stretches it for you, and then where you want to grab to kind of give it that little extra stretch is either up here in your upper forearm. Let me turn this way. Up here like this in your upper forearm, because remember your joint, your hinges of your forearm, one's right here and one's right here. So you can twist it here and get a little bit extra. And you can go here and you can twist it here and get a little bit extra. Now, when you twist it here, that can be helpful. You can also twist in the middle, and then you can also twist over here. It doesn't always have to be here, because the bone is long and both parts of it, the length of it, needs to be able to move in order for you to get the supination and the pronation, right? So you start off easy, just active range of motion. Then you could advance to strengthening, and then you can add a weight to it. Now, if you're just holding on to a dumbbell, it's not giving you the torque. It's not giving you the twist that you need to get a little bit extra for that rotation. All it's doing is you're firing up your biceps, right? Because you're holding the weight and you're just firing up this muscle. You need to hold something that's heavy on top and light on the bottom. I don't have it here. But what you can do is I have a small weight. All right, I have a small weight just for demonstration. But if you're gonna get a little bit of weight, if you don't have a hammer, you can use a weight. It doesn't have to be 1 pound, just an example I have here. But you wanna hold it at the bottom of it, because when you hold it at the bottom, the weight of it will pull and torque your forearm, and then down like this. So those are some just very simple supination and pronation exercises that you can do from the beginning, and then when you're a little bit more advanced. There's a ton more things that you can do, but those are by far the easiest things that you can do. And why are you gonna do like complicated stuff? Let me show you one more that involves your shoulder. So I'm a big fan of making sure that when I work on supination and pronation, I work on the shoulder with it, because when you turn your palm up and down, it's here, but you can also do things where your arm is out here, right? That's eventually. So get you a mat. Oh my goodness. And what you want to do is you want to lay face down. I'm going to take my glasses off. I can't see anything. You're going to lay face down, turn your head to the direction that feels the best, and then put your arms by your side. And then you're gonna lift up. You see that? When I lift it up, my palms are up. Or I can do it when my palms are down. Let me see if I can move you a little bit closer so you can see me. Let's see. There we go. Is that better? All right, so my palms are up and I have to squeeze my shoulder blade, okay? Palms up and then palms down. Which direction feels the best? Now, that's gonna help you with your shoulder moving, but it also helps with your supination and pronation. and it allows you to move your shoulder blade, your shoulder, and your forearm. So it's a really great one. It's an easy one that you can do from the beginning based off of, you know, how your shoulder and how your elbow feels. Again, that's a good one to do with your therapist. I always do it with my patients first before I send them off, because I want to make sure they're doing it right and they're not doing anything that's going to cause harm to other body parts like the shoulder. So when you hurt your wrists, you always want to make sure you're protecting your elbow and your shoulder as you get better, not develop like new problems. Don't we have enough problems as it is? Right? So try those out and then let me know how it goes. But definitely, you know, work with your therapist. You can find yourself a certified hand therapist, an occupational therapist, a physical therapist, anyone who specializes in working with hand and arm injuries like that can help you. One of the things that we can do, especially after wrist injuries like this, is not only am I helping you recover from what you've lost, but I want to protect and catch any particular problems that could come up from these types of issues. And when you cannot supinate and pronate, I promise all these people, you can develop shoulder problems because you're not moving correctly. All right, let me know if that helps. Again, my name is Huang. I have a therapy clinic, hands-on therapy services located in Miami, Florida. My links are going to be below. If you need our help, you can reach out. My team will help you. And until then, like, subscribe, and please consider sharing this video with a friend who might need it. All right, thanks.